Like the big idea here is not this like, oh, how do we get you 10% more efficiency in your nurses? The big idea here is, wait a minute. We probably only have a few 100,000 chronic care nurses in the whole US out of the 3 million total nurses. But we have 68 million people with 2 or more chronic diseases. Why don't we have 68 million nurses? And what would happen to healthcare outcomes if we did? Now, we can never do that in real life, right? But with language models, I think this is the big idea. So I call it my super staffing idea, which is this isn't about how we get 10% more efficient. This is about how do we 10x the number of healthcare workers? How do we use that then to finally deliver better access to healthcare than ever? I mean, everybody's been saying, I want better access to healthcare. I want better health equity. But everything they do is a zero-sum game. If you move more nurses to this underrepresented group, great. But then you took them from somewhere because you only have 3 million nurses to start with. Even genetic counselors. If you get a genetic test in the US, for certain tests, they'll make you meet with the genetic counselor before you get the results. And there aren't enough genetic counselors. And genetic counselors don't actually do diagnoses. They just tell you the result and interpret it for you. I'm like, a language model could do that. And so,
are you sure?
Because
I'm like, I'm thinking.
You should see these, like, there's a lot of knowledge you need to properly do it. And there's a lot of new studies. And, you know, these things are pretty good at it, but not without us training it using genetic counselors. So like if we launched a genetic counselor for doing this, it would be after 1,000 genetic counselors rated our bot and said, it's ready to go. Rated our language model and said, you know what, I think it can go. So we just have a different certification process before we'll put it out there.
Yeah, I have maybe 2 comments there, and one is that I like at HIMSS in Chicago, I heard a debate around, you know, patient access to data, and should patients see, for example, the lab results immediately when they're available or not, or should the doctor see them first? Because sometimes it can happen that because patients won't understand or won't be able to interpret the results, that they might get scared unnecessarily. And that's why you basically need that
Right.
consultation. So that's why I thought, you know, your comment was interesting in terms of, you know, giving the results immediately when they're there, because it does create a certain level of liability, maybe, if you're not 100% sure.
This is actually the beauty of the language model, right? Right now, you're forced between a choice of unsupervised delivery of the information or supervised delivery super delayed because the doctors are not available or the nurses are not available.